This is an explicit podcast where we try to keep the conversations as raw and authentic as possible with no intentions of hurting anyone. So if you're very woke, religious, or sensitive, we highly recommend you do not tune in.
I mean, I was a bit lazy also lah. I was a lazy bum. Lazy lah, do homework, all lazy. They give you all these characters to write like some 100 times each character. So I usually last minute.
I did Chinese when I was level 1 Chinese I was in Melbourne for quite a while. One of the elective subjects are Chinese. So the whole course, you learn, maybe you cover 50 characters, right?
I don't know. I didn't count how many characters because I every time when I go to the teacher, it's like, okay, give me some characters to write. I was like, okay. Then after that, I still remember there was one girl sit next to her. I always copy her. So I always copy her. I was like, okay, you just leave your ruler down a little because it's supposed to cover the characters. And then supposed to count. You know that hang in pinyin, that the one with the English word down there.
Pinyin,
pinyin. You're supposed to cover it and then read the character. So I just told her just to put your ruler down a little bit so I can see.
And she's nice enough to
yeah, she's quite nice. I think I forgot what's her name already.
So you say you're a bad student.
Oh, very bad.
But guys, we have an aesthetic doctor in the house today. Usually people who are bad students don't really end up being a doctor.
Not really. It's actually being a doctor is not. Okay, I'm not trying to boast or anything here, okay? But but frankly speaking, right? I find A levels much harder than medicine.
No way.
Seriously,
Okay.
I think it's probably the transition because I was always in the Malay school. The Kebangsaan school, so I was a science stream then.
Yep.
And then suddenly I went to Taylor's College for my A levels. I think Cambridge A levels. So it's the most difficult subject out of all things I chose. Cambridge is the most difficult one, and I had difficulty trying to, write essays on biology or physics or chemistry in English. So I struggle on that, and then so every time when they come up with a question, it's like everything is still in Malay. It's difficult for me to transition over to English. Wait, so I find that difficult.
Your Malay, you did until SPM level. Right?
Yeah.
But you say your Malay, you're not very versed in it, well versed in.
Oh, Malay. That time in high school, I speak like Malay lah.
Sorry?
I speak like a Malay man.
Oh, okay. But then you just mentioned that you're having trouble with like translating.
Yeah, because everything is in English in A levels.
Oh, okay.
You get what I mean? Biology, physics,
okay.
and everything will be in English. So there are certain words.
Oh, in high school, y'all didn't learn science.
No, probably yours is like you have got a half. The Malay and the English. For me, it's like all pure Malay until Form 5. So there was no half Malay, half English.
So I never realized this, right? But pretty much if you went to any private universities, right, you're going to be facing that issue.
I think now, I'm not so sure, but
your time.
Personally, this is just a personal opinion. I'm a different student, not so clever at the time. So I had a little bit of a problem. So
remove class.
No, I mean remove is when you I think probably they should lah,
Hey, but remove class is why are your English is it or Bahasa is not good?
No, remove class is when you're in primary Chinese school. You want to go to a Malay government sekolah menengah, then you have to go for remove. So then after that, then you go to your normal, your.
But pretty much people around that time, like your generation, when they transitioned from high school to university, they had to learn it all in English.
So I mean, of course, and then I was a bit playful then also lah. Don't really study that much. So my grades were horrible in college. My father even told me, "Are you really sure you're gonna become a doctor?" I still remember my chemistry teacher. Sorry, Mr. Yap. But he told me like, I think you probably need to reconsider your choices, your career choices, because you ain't going to become a doctor. It's like, okay. So, but yeah, I think then of course the maths teacher, the pure maths teacher was like, he was having doubts, but he was very nice. It's like he spoke in this most concerned voice. Daniel, I think you better reconsider your options lah. You're not going to make it lah. I said, okay, thank you, I got it. So after when the the final exam pressure starts to pile up on you. So the amount of tuition I had to do to pick up whatever time I've lost is just crazy. It's like I think I probably spent 60 or 70% of my time in tuition, and then the rest is all college work and things
I
like
think
that, trying to pick up.
you have not bad memory. Can remember all these details.
Okay lah. So actually, I found okay. So all this while during high school and college, I was actually a mediocre student.
You see, there's a turning point, but we'll get to that.
Yeah.
I'll carry on.
So so my turning point was when I was in university. So that was my turning point. So
When
I
the
always
teacher
been
had the talk with you.
not really. Actually, it's more of a self-realization, and then after that, you realize that you actually can. Partly because I went to India to study. So in India that time where I studied was Manipal, and there was literally nothing there. So
What was your degree? Is
MBBS.
which is the general medicine.
Yeah, you're supposed to get a general medicine. No, basically your medical degree, your bachelor's
How
degree.
long is that whole course?
5.5 years.
5.5 years, and then you do probably like a 2 more years apprentice kind of thing, is it?
Yeah, I mean, then you go into your housemanship.
Yeah.
Your housemanship, so that is where you get a temporary registration. That's about 2 years. Okay, now the thing is, I'm talking about based on my time.
Yeah.
Now I think has changed a little bit with all this contract doctors and all. It's a little bit confusing now. So I didn't keep up with it. So I'm talking basically on my time. So. Housemanship is about 2 years, and then after that you do MO. You have to become a medical officer in a certain department for another 2 years. Then you only, then you consider finish your official service.
So, you say you were a bad student during A levels, right? From what I hear, I have no idea, but everyone says it's really intense medical school. Like you basically have no life, no free time or play time.
Well, the thing is, a lot of people ask me, "Oh, you must be a very, very good student, or 9, 8, 10, 8." I'm telling you, nothing like that happened.
Do you cheat on your exams?
No, I didn't. I don't cheat in my exams. Okay. Sumpah, I didn't cheat.
I cheated on a lot of my exams. Okay. Yeah.
So anyway, it was actually it was the right time and the right place, So at that particular time when I got my A-level results, it was horrible. I mean, no medical institution will take me in. Nothing. I mean, I went to the PWTC education fair. I still remember I went and inquire about a medical course in UK somewhere, and then they saw my results. Like they told me, it's like, okay, none of this medical institution will take you in. I took the next bus back home. It's like, you know what? It's like, no way I can get anywhere. So anyway, and then I got one of my good friends, so he called me and said, like, there's this new medical, twinning program. It's in India for the first half, and then after that you go to Malacca.
For the stupider students.
I said, no, I won't say stupid lah. It's a legit program, man. It's a legit program. But the thing is, I guess they want a little bit more enrollments, I guess. And then after that, they saw my results. Said, okay, look, I'll give you a conditional offer. You come in, you sit for your first exams. Yep. Okay, if let's say for first term exam, your first term exam is good, then you can continue. If your first term exam is not so good, then you have to leave the program. So I said, okay. So I signed up, went there, and then after that, so in Manipal, there's nothing much to do.
Yeah, that's what I wanted to ask, because you say that you were telling me like it's not like what you think, like it's you weren't like studying all the time, but what about the entertainment there? Like,
nothing.
No nightlife or
there's no nightlife there. I mean, curfew is like what, 8:30. So I mean, it's actually a blessing in disguise that I went there. If let's say for example I were to go to in other
Melbourne, which I went to,
other like Australia or UK, I probably would not be able to graduate because of too much of entertainment.
So imagine I spent 8 years in Melbourne, right? For example, you stay in the city centre because a lot of the universities, colleges where international students would go are inside the CBD, which means the city centre. Entertainment is everywhere because your friends are staying, a few hundred meters away, So it's so easy to get distracted. It's very common. People drop out, fail their studies because party too much.
Yeah, so it was a blessing in disguise. So I guess me going to India was a good thing.
5 years. So how?
2.5 years there. So there's nothing to do but study. So there's literally nothing to do. I mean, there is one small pub here, and then you're it's India, and it's not exactly like Australia or UK, and it's actually in a very small little town in the middle of India, and it's far away from big cities. And there's literally no distractions, and you have got curfew at 8:30,
Oh,
9
you stay
o'clock.
in the asrama, the
Yeah.
dorms.
So, and they have got police, they ronda around, and you actually will get arrested for being out too late.
So there's probably not many students
So,
failing.
I mean, of course, you go to the library and all, and you come. But if let's say there's like a house party or,
Is there
or-
house party?
Yeah, of course.
Of course.
They have house parties there. So if let's say the house party, then the police will come and everybody get arrested.
People have this they have this stereotype, like they think like doctors, they are like boring people, don't like to party. But I see it as
No.
I see it as
No.
they are probably working so hard all the time. When they have time or balance right in their life, they probably want to.
I think it's because they just party among themselves. That's why you don't find like other people joining in, because it's like, when you spend so much time and in the campus or in work. For example, in campus you're with your friends only, so you party among yourselves. Then you go to work, you're in a hospital, and
You're surrounded by the
you're
same
surrounded
people.
by the same people. So you end up being in the same group, same clique. So you don't really get like not like businessmen or anything
Yeah,
that you have to network a lot
Yeah.
of things. So doctors don't really need to network
you're right.
unless you decided like you want to go to do something.
You make a personal choice lah. I want to go and meet new
exactly.
people like that.
So my turning point was when I was in India, and then after that I studied for my first term. So I really studied. Okay. And I did well. So I was like, okay, this is the first time in my life I actually get good grades,
Because you got no distraction.
Correct.
Got nothing
So
to do.
I said, okay lah. Then I thought to myself, I was like, actually I'm quite smart also. So it's like, okay, not too bad lah. Okay, let's try another term. So after that, another term, then I did very well. Then after that, the third term I did even well. Actually, my results go back to my father and mother. So after 6 months, we've got a short
Well,
break.
how's
So
their expressions? How's their reactions?
I was like, when I went back there, I was like, then my father's like, this one your actual results are. I said, yeah, I think so. Then my mother was like sitting across. It's like, boy, this one, I'm still disbelieved that this is your result. I said, yeah, I also cannot believe, but I did it. So from there, it's like, okay lah. I thought that I'm not too bad lah. But I think the take home is actually in medicine, it's not difficult. Frankly, it's not difficult. You just need two things: hard work. And
That's the difficult part.
no, not hard work, but you don't do like crazy lah. You don't
Like not 8-10 hours a day.
And then I think another one that you must be really interested. I think that's the most important. With a lot of interest, automatically your hard work will come in, because the thing is, if you've got no interest, hard work is no point.
I think you can't say that for, let's say, accounting people lah. Because a lot of people have no interest, right?
Yeah.
And they just like stick by it. And
Yeah, but I think I'm just speaking purely for myself. So this is what my self-realization. So everybody asks me, it's like, hey, medicine it's not easy, but it's not difficult, because the thing is, the human body, right, is the humerus is the humerus lah. It can't be anything else. What you just have to memorize it, and
So, where did this interest stem from?
Actually, thanks to my teacher.
Like, is it nurtured from very young?
Actually, it started from
Or the typical Asian
Form
parents
4.
just want you.
Form 4, Form 5. My biology teacher, he sort of like sparked interest. I forgot what's his name really. Lam Hao Ki. Okay, Mr. Lam, you're still around. I still remember Mr. Lam. He made biology very interesting.
Yeah.
So I was always wondering, he always make it interesting. It's like, this is how the body works, and how this is, how this is what happens.
It's all in Malay, right?
Yeah, it's all in Malay.
Okay.
So when you eat your food, this is what happens. The enzymes that come in, and why this. So it's very interesting to learn the body.
Every subject I had, right, in high school, I had zero interest except biology. And also, it was a plus point. It's in English, so biology was interesting. Do you feel that way also, Sai? Remember?
Biology is my worst subject.
I think because I think it's because to certain people because it's very dry.
Yeah.
It's actually facts. It's like A is A, B is B.
It's all
You
words.
can't- It's all words. So it's like human body. It's like, you know, it's the humerus is a humerus. A femur is a femur. It can't be anything else.
But the way I looked at it, right? So let's say if you compare physics, chemistry, we're not really looking into molecules, you know, directly. It's just things that you talk about also. You can't really relate as much. Physics also is, you know, lots of calculations and stuff like that.
I think you and I probably is the same kind. We like to memorize things. Oh, that's how
I'm
you
bad at
study.
memorizing though.
Oh, really?
I've
Okay.
ADHD. I'm self-diagnosed, okay, based on all the symptoms that this psychologist was telling me, right? I feel like I definitely have ADHD. So it was notably hard for me. For example, I spent 10 minutes. I would have to read a sejarah paragraph 10 times to memorize 20%.
Actually, me too. That's why I mean, but I developed a way of how I.
You can overcome it.
Yeah,
you
I
know?
developed a way of how I memorize things. So a lot of my friends, right, will take probably a month or 2 months max to prepare for an exam. I will need 3.
This guy, I spend a lot of Sag, who is helping out with the AV right now, right? Okay, guys, before we continue, okay, I forgot to do this at the start. This is Let's Get It podcast, guys. If you've enjoyed, followed me up to this point, you watched more than one video. I think it's a kind of like a gentleman's agreement, you know. I put out content for you guys. If you guys actually like the content, leave a comment in the comment section. Like this video, share it with your friends.
Click.
Yes, click that subscribe button. And I always forget to do it at the start and only at the end, and you know, it's pretty long video. But anyways, guys, enjoy the rest of this episode. I remembered because I would spend a lot of time studying with Sack. And did you notice this, Sack? It was harder for me to memorize things, you know.
I think so lah, but because I know Brian, he don't put.
I studied more than Sack.
No. I don't think you put more effort than me. But for me, I would say I'm good at memorizing things, but when it comes to bio, I cannot.
Oh, I mean, so I sort of like developed my own study technique lah. This is just for me personally lah.
Yeah.
I would try to memorize that one page and after that cover it and I write it on a blank piece of paper, so a lot of paper wasted lah. So anyway, so that's how I memorize lah. So for me to finish 3 or 4 pages, it will take me at least 1 hour. Yeah. So it's a very, very slow, long-winded process. So I mean, that's how I got by lah.
So back to how your interest in it stems, right? So is you just generally you like biology subject?
Yeah, I like biology subject. Then after that, I like how is further understand how the body works. So the next best subject to know how the body works is medicine.
Yeah. Okay.
Yeah.
So you finish your degree,
Yeah.
right? Before you were doing aesthetics work, you were working in the hospital.
Yeah. So
okay.
so I graduated in 2004. So hence you know how old I am now.
Yeah, 100 years old.
2004. And then I did my housemanship, which is 2 years in Penang General Hospital. And then
you can't choose where you want to.
No,
do
you
it.
can actually. When we apply with the JPA, I'm not JPA. It's the Jabatan, the human resource for the
Sure.
government. So they let me choose 3 hospitals.
Yeah.
So I chose Penang, Ipoh, and Sungai Buloh. So the reason why is because see, if you're living in Klang Valley and you choose a hospital in Klang Valley, you end up going to the district. They will send you off to the district eventually to serve to another smaller hospital. So I didn't want that.
Why don't they want to keep you in the?
No, it's
Klang
part
Valley?
of the curriculum. So basically, after when you are a medical officer, then after the first year of being a medical officer, the second year I think they send you to a district hospital.
But it's also like contract like you're not.
No,
gonna-
contract. We are all employees of KKM.
Yeah, so like they say that okay, we send you to Penang, but you'll be there for 2 years.
Yeah, so something like that. So I applied to be in Penang because eventually it's easier for me to come back to KL. Okay, so this is my own theory. If the government people ask, not the same. Okay.
Yeah, they won't watch this one.
so anyway, so that's my own thoughts. So I went to Penang and spent two years as houseman, and then after that another 2 years as a medical officer. And
Medical officer
Yeah.
is
medical officer is a fully registered medical doctor. So I mean, you start off as a house officer.
General, is it general?
Yeah, and then after that you become a medical officer. So medical officer basically that means you are fully registered. So as a housemanship, you get a partial registration. So that means you're not liable. You're not liable in the face of law, but you have got a supervisor who oversees you. And when you are a medical officer, then you are fully registered. So if let's say, and what does it mean? You are then liable in court. That means if something happened, they can take you to court, and your word.
Okay. So when you say general doctor, right? Let's pretend like I don't know anything. Most people watching also probably wouldn't know if they're not in medicine lah. Like, what sort of work do you cover?
Okay, so as a medical, actually basically as a medical
there has
officer,
to be also departments.
yeah. So as a medical officer, you go through various departments. So you go through okay, for example, like me, my first posting was pediatrics. So children.
Yeah.
So I will spend like 3 months in pediatrics. Then after once we finish that rotation, we rotate to another department. The second one was.
It's intentional in their training.
Yes,
it
is.
Okay.
It is compulsory. So you go through different rotations. So mine was pediatrics. Then it was obstetrics and gynecology, and then after that the surgery, then medicine, and then after that something else. Okay. So it is compulsory. So there are 5 core departments you have to go through. So what I mentioned, peds, obstetrics, gynae, and then surgery, medicine.
Forgot one more.
So long.
Not good. How long did you actually spend doing the general
2 years,
doctor?
2 years.
2 years.
2 years. So you spend 2 years rotating various departments. So you learn different skills. Different skills on, like, for example, pediatrics. So you learn things, how to treat.
Hands-on work.
Yeah, hands-on work on how to deal with kids and things like that. And then you go to obstetrics, gynae, you learn things regarding women and things like that. And you pick up things along the way. So the more you do, the more skills you pick up, the better you are lah.
Yeah. So what happens after the 2 years? Do you get to decide what you want to specialize in, or do you have to study further for that?
Okay, so after when you finish your housemanship, become a medical officer, so you then will be placed into a department. You won't be doing any more rotation.
You can't choose, is it?
Usually, technically you can, but usually you can't. So because that time doctors were so little, so scarce, so that you can't choose unless you decide to. You already know what you want and you want to become a specialist in something, then you hit to that department. So for example, like, okay, after for me I was pulled into plastic surgery in Penang.
This was
back in 2006.
Oh, so early on already you were into that.
So
okay.
Actually it wasn't my choice.
Yeah.
So I was actually pulled into plastic surgery, working with the best plastic surgeon in
sorry to cut, but just by the way, you said like it was very scarce right back then. Take a wild guess, like how many child psychologists do you think there are in Malaysia? I talked to one recently on the podcast.
Yeah, I don't know, not many.
10.
Yeah.
So she told me 10, and I'm like, what? And I said like they're all in KL. And she said, yeah, all in KL. You know,
I'm not surprised. I'm not surprised.
You're not surprised.
I'm not surprised because there are various subspecialty and subspecialists in Malaysia which are lacking. So
But child psychologist
is very niche lah, very very niche.
Is it? Psychologist itself also, she said like psychologists are not child psychologists. She said about 30 in the whole Malaysia, and I'm so shocked. I spoke to 2 psychologists. I'm like, is it that scarce? You know, I mean, also fortunate enough.
Psychology is still a taboo here. Nobody wants to go into I mean, people every time say, you need some help. Go psychology, you crazy. You think I siao ah?
Dude, that's exactly what the Dr. Katiana said. Okay, when you talk to people about psychology
it's still a taboo.
They associate it with Tanjung Rambutan.
Yeah.
Yes, and if you want to think further back lah, okay, we talked about lobotomy with Dr. Lenny back then. So you know what lobotomy is, right? Is that offensive to you? That I had to ask you that? No, but okay. Yeah, back then people would do lobotomy if you were depressed. You know, you didn't behave well, you were being naughty. So they'll stick a metal rod through your skull. You know, that was back then. Now, of course, it's a more civilized way of working on things, right? You go through therapy, you speak to someone, psychology. But yeah, in
That-
Malaysia,
it's still scarce. I mean, there are a lot of subspecialty in Malaysia, which is also still very scarce. So back then, doctors were still even more scarce.
what about in your initial field that you started out in, like the plastic?
I mean, actually, it was not a field that I started. I was pulled into plastic. I was pulled into plastic to be a medical officer
Because
there.
they were lacking in that
They were
department.
lacking of doctors to run the department. So I was there for about 2.5 years. So I actually wanted to.
Sorry, this is in Penang, right?
Yeah, this is in Penang.
Okay.
So I actually wanted to do other departments. For example, like I didn't get to do orthopedics, frankly.
What is
because
orthopedics?
Bones.
Bones.
And an emergency department.
Were you interested in bones?
No, because I wanted to expose myself. I wanted to expose
Try
myself.
new work.
Because I've done all the main 5.
Yep.
Plastic surgery is a very subspecialty part of surgery.
Yeah.
So it is very interesting, frankly speaking. But then again, I wanted to complete other things. So when I did my housemanship, I mean my first 6 months there, I actually asked my boss whether I can transfer out to another department to complete other specialty to
Cover
see where my
everything.
interest lies. Because frankly, at the time, plastic surgery was interesting, but it wasn't really something that I wanted to do. So I wanted to try out orthopedics and emergency just to see whether I have interest there and that or not. But
Never got a chance.
never got a chance because my boss loved me too much.
Ah,
So
love you or they needed you lah.
so I was there for 2.5 years, which I'm very thankful actually. I learned a lot of things, a lot of skills, which is related to what I do today.
Yeah. So also we're gonna dive deeper into what you do today, which guess how long we've been doing it is 30 minutes already. Very long. But anyways, so when you say you were in the plastic department, right? Like what is that lah?
Actually, frankly speaking, in Malaysia, it's not like the plastic surgery like you see on
Nip and tuck,
television. Like, nip and tuck. Or in Korea, you see, the eyes become big nose and then big boobs and things like that. So those are enhancement. So in Malaysia, it's more of plastic and reconstructive surgery. That means those basically they have some in when they're working they
Gone through accidents. Yes.
The nose got cut off,
Or
they
burnt.
lose the ear, the face is dismantled or something like that, and they need to patch it up or
Yep,
need to fix it, or they need to create a new nose, for example. So these are all reconstructive work. Or someone with got a when they go through accident and then they smash their skull and then it's not depressed and then they have to reconstruct the skull again.
I kind of associated this like a bit with like cosmetic doctors, which is it's not really the case, right?
No, it's reconstructive. Reconstructive. So plastic, the part the juicy part that you like is all the
Boob
double
jobs
eyelids. That's very, very small part of what plastic surgery is.
But did you guys even have to work on that as well? Did you?
Because
No, right?
because the plastics where I was exposed is actually more towards trauma, like burns cases, like people burn and then they needed skin grafting, and so mine is more of towards reconstruction. But what I learned from there is basic tissue handling.
Okay.
So I learned a lot of the skills where I have now is actually thankfully because of plastic surgery, because you have to handle the skin in a very gentle way, and the principles is you don't cut out so much, you don't throw away all the skin, try to conserve as much as possible, very good tissue handling, clean and things like
Like
that.
a watchmaker requires years and years of.
Correct. So then
How long were you in that sector?
2.5 years.
2.5 years. So how did we end up here right now?
So after that, my boss, my ex-boss, she was the head of plastic surgical services last time, so it's very, very, very influential person. So she said, "Okay, Daniel, you want to do plastic surgery?" I mean, of course, that time I didn't say I want to, but she said, "You want to do plastic surgery? You have to go through Masters of Surgery first, and then come back to Penang and do your subspecialty in plastic and reconstruction."
You had to be full-time studying.
So I have to be full-time. I mean, study and work in the same time. So I have
Okay.
to, because
Oh dear, that's
surgery is you have to become a specialist in general surgery, and then sub to become a plastic surgical. So you have to go through a master and then sub, and then like another master, something like that. So I applied for masters in surgery. So that is how I got transferred back from Penang to KL. So because when you do masters of surgery, you have to be attached to a university. So I was attached to so University Malaya. But so I have to be transferred back to Klang Valley to...
Which is what you prefer though?
Well, which was the plan. Which was a plan. But for me to come out from Penang, I have to join a master's program. Then she'll let me go. Because, otherwise I'll be there already. So anyway, so I joined the master's.
How long was the master's course?
The master's course was actually... 4 years.
4 years.
4 years.
Whole time
but then again, I didn't join immediately. So I came back first, and then after I was working for a little while, then after that I applied to become masters to the master's program, and then after that, then only I got into the program, and then I started. So there was a time lapse there. So I started my general surgery, and then it went on.
What do you mean you started general surgery?
So I was attached to so I went into the general surgery program and the master's program in general surgery. So I have to be attached to
general surgery. That's what your mentor was saying.
Yeah, you have to go into general surgery first. So I have to do in general surgery. So I got attached to a department of surgery in Kuala Lumpur. And then after that, then I went through, and as a surgical, so you're called a surgical trainee then. So you also go through the various surgical subspecialty field, such as brain, heart, liver, endocrine, which is thyroid and breast, and then also urology. So all sub branches of surgery you have to go through to find out which one you prefer. So but then that definitely but that is like the program lah. You're
okay. So have you had like experience doing like major surgeries on
organs? Of course. I mean, I don't do it, but I assist.
Okay.
Because we are all trainees only ma, so all the big huge major operations are usually done by the consultants and the senior consultants.
The ones that are doing it are the head are surgeons or?
So basically the consultants or the really experienced
yeah, but that was never what you wanted to.
So then we do the small ones like appendectomy and all these things.
Appendectomy is appendix.
Appendix are the small tiny one we all do lah.
Yeah.
Hemorrhoids all we all do lah. The big ones all the.
What was that you say?
Hemorrhoids.
Hemorrhoid is back.
No. Hemorrhoid, that means your backside bleeding. Like
Oh, okay. No, that's hemorrhage. Hemorrhage is the head bleeding.
Yeah. So then how did I end up being a study doctor? Okay,
it's a long story.
It's a very long story. So anyway,
I thought it would be 10 minutes.
No, then after that, when I was going through the master's training, and I realized that general surgery was not for me. Somehow or other along the way, I lost the passion for it. So I wasn't interested in surgery anymore. I mean, also
which year was this?
I think it's near to 2013. So I was getting a little bit depressed. I wasn't able to fit into the program. I mean, it's not the program's fault. It's my fault probably. I couldn't fit into the program. I wasn't performing well. So I decided to make a big decision to come out from the master's program, to quit from the master's program.
Maybe it was what do you call it? Burning out.
I guess so. I burnt out. I lost the passion for it, and I asked myself the question. I mean, can you really become a good surgeon? After if you pass out also.
Yeah.
Like the answer to me is like no. So lost it already lah. So I decided, you know what? I'm going to come out from this program. It was a hard decision to me. I think one of the hardest I've made in my entire life.
Would you say that's around the time where you met with Dr. Lenny?
No,
that was after.
That's after.
Okay.
So anyway, so after that I thought, okay, what am I going to do? So after so many years, you still have the skills. Okay, although you don't have the passion to do it anymore, but you still have the skills and you still have the know-how.
You mean
you have got certain
skills.
Dexterity, the surgical dexterity. You still know how to handle tissue and things like that. So what do you do? So I like pretty things. I like pretty things. I like to make things pretty. I like to make things pretty. And then what can I do with good set of hands? So I thought, okay, like aesthetics. So aesthetics at the time was quite booming already.
Yeah.
So
Definitely,
I decided,
definitely.
It's booming like it's
Yeah.
like exponential.
Even
already.
years before that, a couple of years before that.
So it's exponential, it's booming, and then I decided, okay, I'm gonna do this because it's something that it fits the lifestyle I want, and then after that, it's I don't want to see cough and cold.
Talk about the lifestyle. Basically, you run your own clinic.
No, not really. I mean, basically, day job. I don't want to be on call, that kind of thing.
Okay, so when you were that one I didn't ask. Funny enough, right? The last podcast guest I had was Fazan. He was in the general hospital for I think 3-4 years, and he recently moved into an aesthetic clinic. It's just coincidence and he told me also like he just couldn't take the lifestyle was very very hectic, he didn't have much of a social life. And then he also figured out what he really enjoyed was doing aesthetic work, you know.
A lot of people will say aesthetic is for all the dumb fellas all the lazy fellas, or don't want to work. But then again, I mean, that's just a personal opinion for me. It's something that I like to do, something that I'm passionate about, and I still have skills.
Hey, we are very behind, man. We are very behind in terms of perspective, right? Where people would think that, this guy likes to do aesthetic work, like pondan like that.
It's
they think stuff like that.
I mean, I've been to a couple of conferences, and also visiting other clinics from other countries. I mean, visiting clinics in other countries. Malaysians generally, they are, in terms of aesthetic or beauty acceptance, are way behind. I think as back as 2014 or is it 2015, I went to Taiwan for an excursion, so to speak. So it's basically like a conference and excursion, and then you go visit clinics to see how they run the clinic and things like that. I mean, people there are coming in to do their injections, like how you go and ask the
like
shop.
physiotherapy.
It's like how you go to a shop and ask, okay, I want this. Yeah, it's like that. I've seen like, okay, I'm here, I want to get my lines done on top. Then you will tell the doctor, this is how you should do it. How many units I want. Okay, like that. So in Malaysia, it's like still Botox. Cannot.
You know why? I have to cut this part out lah. But the number one thing people gonna associate it with, right? They're like, aesthetic doctor. That's who is contributing to how Rosma looks right now. That's what they are thinking of lah. They'll think of Michael Jackson, celebrity that's gone super wrong.
Well, I think the problem in Malaysia is they want to try it out.
Yes.
But I think that is just too much of misinformation. I think that is the number one problem. It's just misinformation. It's just, I mean, even like, just take for example, like the recent COVID. The amount of rubbish that comes into the news feed is like mind-boggling.
Okay.
It's mind-boggling. So it's like, okay, things that doesn't make sense at all will surface. So extrapolate it to the aesthetic industry.
How many people wear a mask even though they don't want to wear a mask, or even though they don't feel any point in wearing the mask? Is that what you're referring to?
No, not that. It's just that like last time they talk about the misinformation, like the anti-parasitic pills.
What's it called?
Then after that, then on top of that, you have got our ex-minister who asks you to drink warm water. It's like I mean, and you know what? And people are sometimes they are vulnerable. They might actually
my
some
parents
people
will believe it also.
they might be the what do you call it, the water filter. The water filter sales might just go up because you have to drink warm water. I mean, people are that naive sometimes.
My mom was forwarding this text. How to cure COVID: 6 cloves of garlic, throw inside boil it and drink it. So it's just typical misinformation on WhatsApp.
So in aesthetics also, there is a lot of misinformation. So
let's start out with some basics. Okay, the most popular ones right now. What is a filler?
okay, basically fillers are materials which you inject it underneath the skin to plump or to support the tissue. Okay, how I usually tell this to my patients lah.
How about how you differ it from Botox?
Yeah. So basically, just think a car. Okay, when you get into an accident, the car is dented.
Yep.
So what would you do to the dent?
Gotta kind of push it back out.
Push it back out, or if you can't push it back out, you fill it, isn't it? You fill it before you paint it over, isn't it? So yes. So in that sense, just imagine, as you age, there are certain dents and holes on your face which you do not want. Like for example, like some people develop an deep eye bags here, or suddenly the cheek sunken because aging takes place. There are certain processes. The aging takes place, so the face is sunken. So how would you plump it back up? Similarly, like how a dent car, you want to bring it back, you have to knock it, or you have to fill it before you spray paint over, isn't it?
Yep.
So filler does that. So you inject the filler and you plumps it back up again.
What exactly is it that you're injecting inside?
So usually, the most common and the safest material used is hyaluronic acid. So that's the safest.
Would you say it's the most pricey one as well?
Well, there are others which is even more pricier, but I think hyaluronic acid is by far the safest. And it's and because before this there was a lot of collagen fillers which produce a lot of allergies. Then after that, prior to that was the banned substance called liquid silicone, which they inject it. So it's banned now.
Into the face?
Yeah, to plump it up. But unfortunately, those people who have done it 50 years ago suffer the consequences now.
Wow, so much to ask. So collagen has a very good reputation. So why do you say that, like, people don't, you say that they don't inject?
Because collagen essentially is a protein. Okay? A protein, when you inject it into the face, they have got some allergy potential.
Okay.
So and the body might react to that.
It might work for someone, it might not work for
correct. And it's very expensive as well, and so that's why it's not used. So that time was, I think it was 40 years ago where this stuff came out. Then after that it was this what they call it is phased off, and then it's replaced by hyaluronic acid. So hyaluronic acid by far is the safest,
most common,
and also biologically compatible with the human, because the thing is, we our own self produce hyaluronic acid. Our joints, the lining of the stomach, the skin has hyaluronic acid. So the molecules and things like that are similar with the...
Do we produce collagen as well, our bodies?
Of course we do.
Okay.
Of course we do.
Okay.
I mean, not the collagen like you think, like it's in a like gel like that.
Yeah,
I mean, there are different types of collagen.
I don't know.
So hyaluronic acid is by far the most compatible material which you can use as a filler.
How long have you been running this aesthetic clinic?
I've been in this industry about 10 years already. 10 years. So I actually recently just set up my own practice.
Oh, this one is a recent one?
Yeah. It's, last year.
Okay.
Very, very new. So before this, I was an employee in two other aesthetic clinics. So then after that, I decided to start on my own.
Sure. Do you refer to them as clients or patients?
Yeah, clients most likely.
Clients?
Yeah, clients.
Oh, okay. What is a suitable age for someone to start doing aesthetic treatment?
Aesthetic treatments, you can start actually any time. So there are things that you can start early, the earlier the better, frankly speaking. So actually, essentially, essentially we are buying time, technically. Because say for example, things like wrinkles on the forehead, Botox. So you have got a pair of twins, who are of the same age, probably 20 years old, say for example, one starts to inject Botox on the forehead and also the crow feet.
Earlier than the other.
Earlier than the other. Maybe 10 years later, the one who did not do anything will look much older than the one that has done something. So essentially, you're buying time. You're buying time. So a lot of people say, oh, you only get your lines, then you need to do your Botox. Okay, you can. Frankly speaking, it's a personal choice.
Of all of it is a person.
Yeah, it's a personal choice. But then again, Botox can be preventive too. If you don't use that line, you don't frown so much, or you don't, do that line so much, and then eventually you wouldn't develop
So
the lines.
it's true. Let's say if you do put some Botox to remove or make it less visible, the lines on your forehead, if you frown more, it will come back sooner. Is that how it works?
No, it doesn't really, because the thing is your muscles are asleep already. So you want to frown also, you can't frown.
What happens when you put a Botox into your...
So Botox technically is it's like this magic potion that you inject it into the muscles of the face. It's in liquid form, and it puts the muscles to sleep. But it won't put the whole muscle to sleep, but part of the muscle will sleep. So for example, like the muscles around the eye that is, involved in blinking and, like squinting and things like that. So when you have, when you animate, when you make, faces and things like that, and your muscles are moving. So, and these muscles, contract over the skin here, and the more you use it, it contracts the skin more, and it produces the line.
Okay.
But it's essential because that the muscles around the eye is essential to open and close your eyes, but you cannot do the whole eyes. What?
So the more you frown, the worse it becomes.
Yeah, if you don't do anything, the more you do, the worse it becomes, because it will sort of like affect the, like for example, the lines on the top of your eye. You keep on frowning all the time, you keep on producing that. Over time, this line will become permanent. So you want to prevent that from happening, you just put the muscles to sleep. And then after that, eventually you will then not frown too much anymore, and your lines won't come so early.
Okay, let's say I'm a client, I walk in and I say that I'm not happy with the way I look, my face. What do you suggest that I can get done? How do you go about that consultation?
Okay, actually this first of all, how I consult. Say for example, you just walked in and then I say, okay, I'm not happy with something, but but you don't understand why you look like that, and things like that. So so usually I would ask you a whole bunch of questions. I'm trying to understand you, because the thing is, you have to understand. Looks is not only just looking yourself in the mirror. No, it's actually your emotion as well. You're feeling sad. You get what I mean? No? You see yourself, you're feeling sad. So I have to try to convert. It's a bit of a I have to do a bit of psychology.
Okay.
So I have to understand. Does this make you feel sad? Okay, does this look make you feel sad, and things like that? So if it does, then there are certain things. Then I have to understand why it is happening. So is it because if it's genetics, or is it because of aging and things like that? And then after that, understanding why, then I say what is happening at that particular area, which is probably there's not enough of fat here, or the is sagging and things like that. And then after that, then I will come up with options on what you can or cannot do.
What you're trying to say is sometimes people walk in the clinic and they tell you that they want you to do some work on their face, but you feel like there's deeper psychological issues that they may be facing.
There's always a emotion attached to it.
Always, or most of the time? Yeah.
Most of the time.
Because some people just want to look better, right?
Yeah, but still there's be an emotion. The emotion will be make them more happy. So that means if let's say I will do this, they will become even more happier. So that's okay.
Yep.
That is progress. Okay, so
Yep.
that's okay. That's fine. But some people do it, then the worst thing is if you do it and then they're not happy.
They don't even feel happy.
They don't feel happy. Then it's the worst.
It's very ethical of you to do this. Is this something that you guys learn, or it's just common practice, or is this something that you personally do?
You eventually will pick it up. Actually, it is taught. It is taught to, but it is very in a raw form. Basically, it's very structured. It's like, okay, know the diagnosis, know the problem, and then deploy your methods or how you want to do it. So of course, then this is like it's like on the book. Okay,
Yeah.
know the diagnosis first, then deploy your methods based on medicine.
Yep.
So Then you refine it a little bit.
Yeah.
Then you refine it. Then you find the ways to ask and things. So of course, I've done this mistake myself. Sometimes because you're just too anxious. Okay, you get this done, you get that done, you get this done, get it done. But then again, you forget that you
need to satisfy the
you
client.
need to satisfy not only the results, but what is important first.
Which is the long-term satisfaction.
Yeah, correct. So I always, most important thing is manage your expectations.
You mean clients' expectations?
Yeah. So the thing is, in my first consultation, right, even before I touch you, I'm managing your expectation already. You get what I mean? I'm already starting to put in points to manage your expectations, because the thing is, you. So a lot of customers, they come in like, you have this big, huge, grandiose idea. I want like that. I do this, I must get like that. I do that, I must get this one.
So what is they will pretty much show you a picture of who they want to look like.
Correct. So they say, I want to look like this, I want to look like that, I want to be like this, I want to be like that. My nose want to be like that. But you have to understand, you're not her.
Yeah.
You're not that person. You're not born with that that muscle structure or the bone structure to support that kind of that kind of look.
Because it is true, you can kind of shape people into anything that they want, but like you said it will not. Your bone structure might not support.
So the thing is, I have to start managing. So a lot of people say, because you have to understand nowadays with the camera, right, and it's all filtered.
It's crazy.
And then it's like, okay, that one is a filtered
It's
picture.
very common people come in to show you a filtered picture.
And 99% of the time it's a filtered picture. I want to look like that. I was like, oh, this one very difficult. Hey. So, and then after that, they have got very, very high expectations. Very high expectations. So if we don't start managing the expectations, then whatever you do, they will not be satisfied.
Yeah, and let's just say business-wise, word of mouth is very important.
Yeah.
So you have to also think about long-term satisfaction of the customer.
So for me, my number one thing is manage the person's expectation. And then after that, number two, if let's say they choose not to do anything, it's fine. The next thing that my goal is to make sure that they are not misinformed. Any misinformation is clarified. Number three, at least they walk away with something, with a knowledge. So that's something that I always, try to advocate and try to make to tell them.
From what comes to mind now, what is maybe you give a couple of examples of the biggest misinformed.
The biggest misinformation is Botox. Until today.
So what is their misinformed perception of it?
They will look like someone. Okay, for example, like they will inject Botox. Oh, I immediately will look like some people.
Yeah, got you.
So and then and that is what I want to dispel, because I do Botox for my own family, my mom.
Yeah.
If let's say, for example, that particular procedure is so detrimental, and it eventually become that person, would I do it to my own mother? Absolutely not.
I mean, you might, but I trust that you won't.
You absolutely won't. It's absolutely misinformation. And the worst thing about some Malaysians, they just love hearsays. They love hearsays, like 我聽講啊，邊個。I hear someone saying this. I'm hearing someone saying that. Oh, that auntie at the market, and she was saying something.
They don't have medical degree.
I said, the auntie in the market sell vegetable got medical degree or not? No, right? But listen to her more than me, right? It's like that. Yeah. So I would. I mean, actually, it's good that we do this podcast, because I want to make sure that we dispel some misinformation, and there's a lot of misinformation out there. A lot.
Give me another example. I'll make this into a reel. Yeah, another example.
You get worse after you do something. You don't get worse after you do something. I mean, the thing is, why would I do something that makes you look worse if, let's say, you don't continue it anymore? No, in fact, I gave you a very good example of that twin. You buy time. The reason why you feel that you look worse than before is because you forgot how you look like.
Also, there's because people see celebrities that have gone wrong. So let's talk about that. I'm sure there has to be a reason how someone looks a certain way, where and 99.9% of the public can also tell, like, that's how does that happen?
Greed, lor. greed from both sides, greed from the patient and greed from the doctor, because the thing is, the greed is the patient wants some more. And then if the doctor is not the ethical one, or the one that just want to make money out of you, okay, can. There's no stop to it. So, and then from there it gets worse. So, and then some people, put their foot down and say, I know, I really want to get this done, and things like that. I give you all the money in the world. So, yeah, and then it goes wrong. So, back to how I want to be, as a doctor, as a medical professional, how you want to be perceived, as a greedy person or someone wants to help you. I know that in aesthetics, right, it's basically treating normal people.
Yeah.
But the thing is, you also be ethical, The thing is, okay, you've already achieved the result that you want initially already. You're happy with it, and then just stay there, and then just maintain. Or don't try anymore. And furthermore, frankly speaking, the things that you see on social media, like celebrities that have gone wrong, most of them went through the knife.
Oh, is a big difference.
So that is a very big difference. So a lot of people tend to group the whole thing together. Yeah. Plastic surgery and aesthetic. We are just handling needles. We are just handling needles and maybe some machines. And needles and machines, there's only a certain, it will reach a threshold of what they can do, reach a threshold of potential. There's only so much you can put fillers. There's only so much you can put Botox.
Are there specific cases of just aesthetic treatment or fillers that have gone wrong as well?
Absolutely.
Which is same reason why it happens.
Yeah. So it's same reason why it happens, and also I think another very big problem in Malaysia is they go to the non-medical professionals to get it done.
That's another thing I wanted to bring up, because there's a lot of people that are doing it without a proper license.
So there are a lot of them who are doing it without license, especially, I'm not going to see what particular industry it is, but especially those beauticians and things that. Yeah. So they tend to want to get into these injectables and things like that.
Yeah.
So, and if you see in the media, right, if you really dwell into the media, right, like you go and see this Michael Chong, the MCA, get a lot of all these complaints, blotch jobs and things like that. And most of the time,
sorry, I'm not familiar with that case. What
okay, so basically Michael Chong is an MCA guy who helps the society to into all this blotch jobs or missing person, kidnapping. He's basically like this go-to person to help people.
PI guy.
Yeah, not really lah. So he helps people to mitigate things and things like that and get things going. So a lot of complaints. You see, so a lot of these people, when they go to these beauty centers and get it done, and then things go wrong, they don't know where to complain. They don't know where to go to. So they go to this particular person, Michael. He helps this person to make a police report, or go to certain ministries and get explanation for it. So a lot of blotch jobs are done by beauticians. No doubt.
Yeah.
I'm not trying to say they're no good and things like that. I'm sure there are.
Just differentiate a beautician.
Yeah, so the beautician, they are non-doctors.
Yep.
They are handling the needles and then injecting things. Probably they have done it a long time, which is under in the grey area or somewhere secret. They are doing it for years. They probably have got very good skills, probably, and the difference between a beautician and a medical doctor is, if let's say things do go wrong, we know how to fix it.
Also, it's a whole well of knowledge that they are lacking.
No, I think I am not surprised that beauticians sometimes can be more clever than doctors.
Which comes with experience.
Yeah, of course.
But they are not qualified.
They are just not qualified. We go through stringent medical training and things like that. But on the subject or the action of doing that procedure, probably they have done it 100 more times than me.
Yep.
So they're probably more clever than me in terms of injecting that one particular area. So, but then again, when things do go wrong, then they don't know where to go, don't know how to fix it, and then after that, that's where all the bad things happen.
Also, regardless of qualified or not, right? it's the ethical side that is more I guess that's more prominent.
Yeah, so the thing
how
is,
it goes wrong.
back to your first thing where all the people who have done and then horrible
Yeah.
outcome. Like I said, there's two people involved. The one giving it and one receiving it, both also very greedy.
Yeah.
You get what I mean? Then
Yeah,
after
yeah,
that,
yeah.
things do go wrong, and then you just have to sometimes say no. Enough is enough, because
Yeah.
I do have people who, after one treatment,
It's bound to happen,
after one treatment and another treatment, then after come again, and then I want some more. I a few times I draw the line. I said, no, I'm not doing it. I said this will go sideways if, let's say, for example, we do it some more.
Do they ever find another doctor?
They probably will. So I'm not surprised if they actually go somewhere else. But because, frankly, I also don't want anything happen, and I don't want to go and sleep at night peacefully,
Yeah.
So because I know, because you have done it, with your medical knowledge and things like that, you really can predict that the outcome will not be good.
Yeah. Maybe you can give an example of what the client suggested.
So for example, like some certain people have got fillers done to the face. Okay? First treatment is very good. Second treatment also very good. Because we don't do one shot, we just do a couple of places at a single time. So overall outcome is perfect.
Let's say, for example, if I want to do fillers on here and here, I would do this side. I'll do my left cheek one day, and then the right cheek one day.
Usually we'll do symmetrical. So basically, if let's say we do top, middle, and low. So
Okay.
it's either you do the middle first, then after that the next treatment you go to the lower bottom, and then the third treatment you go to the top. So okay, now this is just how the treatment goes. But sometimes after the treatment already, the results are good. Results are good, satisfied, and things like that. Then after they come, I want more.
What is the recommended, right, cooling off period?
There's no, I mean, of course, from one treatment to another treatment is about 1 to 2 months, like that.
Yeah.
Usually the safe gap is 2 weeks to a month, like that.
Yeah.
But then it's not about the gap, it's about how much you put in. And then also sometimes,
You mean the filling?
you want to
Okay.
fill up something. So you have to, you see, in aesthetics, you have to create a harmony. You have to, you has to harmonize with the whole face, not like, you want to, your chin super long, then it looks very odd, isn't it?
Yeah.
So it's like it has to fall into certain proportions, and then it looks good overall. But some people said, because sometimes when you, especially the young ones, they like to take selfies and things like that. So, and when you do the selfie, and then when you have an accentuated look, it looks really good on the what do you call it, on your selfie.
Yeah, your photos. Yeah.
On your photos, you look really good because it's accentuated, and then the camera picks it up and makes it better. But then again, when I look at you as a real person,
Or when they look in the mirror.
when people look at you, look odd because everything is so accentuated, and it doesn't look normal anymore.
Yeah.
So basically you have to. So there are people who have said, okay, you know what, I'm not going to do it anymore. You say, I think if you put some more, number one, it's just going to cause a lot of pain, or number two, it's just going to make you look very odd. So I have to reject, lor.
What do you mean by it'll be pain? Let's say if you're just doing a normal filling, right?
Yeah, for example,
The pain will last a
like
couple of
like
days,
the
is it?
chin, like that. You only can put so much of fillers into your chin because it's such a tight area. You put like a lot in there, it's going to be even more tighter. It's going to create a lot of pressure. It's going to do more harm than good. So yeah, I mean, so there are certain there will be instances where I say, you know what, I'm drawing the line and say, I'm sorry that I don't think I'll be able to do it anymore.
What do you think, when I'm sure by now, right? Let's just say you look at anyone's face, you can tell 99% accurately what they had done.
Not already.
Not really.
No, not. I mean, a lot of my colleagues are all very, very, very skillful. My friends are all skillful people, so they have got an eye. They know how the right techniques, and sometimes it's just done so tastefully you
That you
wouldn't
have
be able
no
to tell.
idea.
I mean, you're talking about minimally invasive. Yeah, you're not talking about surgery.
Oh no.
Yeah. So it's just basically like, for example, like fillers and Botox. Sometimes it's just done so tastefully, you can't tell. In fact, it improves the person's overall look and it looks so natural, and it's just amazing.
People just think that person is younger.
Yeah, people just think that that's you lah, you know.
Those people that have, let's say like, it's gone very wrong, right, because of greed from both sides, doctor and the client. Is there a turning back?
Well, the thing is, it depends on how severe it is. I mean, of course, there are certain
What's that person's name? Donatella Versace.
that kind of level. I send it to plastic surgeon already. Because I mean,
even with plastic surgeon, can you come back?
I think I don't know. I'm not sure because I don't want to comment on that because I first of all, I don't think it's right for me to comment because I don't know what goes through. You know, I mean, it's just on face value. It's like, okay, she looks very odd from her initial, but then again, maybe she likes it.
Maybe.
You know, I mean, she likes it and she's happy with it. So
yeah,
you know what is our? I mean, what matters is our opinion.
Of course, there is a societal standards for beauty lah, but then also what is, I guess, important, or what is you should respect is what people want to look like, right?
Well, the thing is, I think, again, back to the first initial is manage the expectation. You see, a lot of people want to look like this, look like that, but then again, it will not look good on it. Because the thing is, you have to understand, you have to respect your own looks as well. Because you cannot take someone else's face and plaster it on your face. It's just not possible. Usually, I would tell them that, okay, looking like that is impossible. But then again, let's just try to improve on certain beauty areas of your face which you want to improve. Then maybe you can sort of like, accept. Because the thing is, it's all about managing the expectation. Because they want to look like that and this and that. So it's not possible. Unless you go under the knife lah.
I think something interesting that a lot of people would like to know, how many % of your clients are males?
Actually, it's getting more and more.
I would assume so.
I think if I look back in my own what do you call it, the demographics.
You mean your clients?
My clients are 70% are female, 30% are male.
Oh, that's a lot. I expected somewhere between like 85 to 15%, you know?
15% male.
Yeah.
No, they're now coming up more and more.
And you've been in this industry for 10 years, so
I see the trend of males wanting to look, a bit more younger, a bit more presentable. You
see a lot of influencers is also you can tell that they've got something done, you know.
If it's surgery lah, if it's surgery.
You think so?
If it's surgery lah, usually okay for you see the different in ages, right, requires different sort of things done. So usually the young ones, the 20 plus, they usually are not. They are not aging.
Yeah.
You know, they're not sagging or anything.
Yeah,
they're still looking good. They're still beautiful.
Yep.
But they want to be accentuated. That means I've got a nose bridge. I want to make it a little higher. I've got a bit of a cheek, but I just want to make it a little bit more prominent. I've got already a chin, but I just want to accentuate it a little bit. You know, I want to make it a little bit more V because it's not sagging, but I just want to make it a little bit more V. So how to do it? So a lot of the young ones tend to go for the accentuation, things like that. So the middle one, coming to the aging group, probably about 40s. So they are now having signs of aging. Starting to have signs of aging like sunken cheeks, you know, starting to have downturned lips, you know, and under eye bags and troughs and dark eye circles and things like that, and starting to have a lot of lines. So that is where my favorite area comes in. I like to restore. Okay. So restore means what? Okay, something basically like, you know, like for example, like a statue. Like a statue is been ravaged by time. You have got chips, you've got rusts, your cement is coming out, you know, your cracks here and there. So I restore. So I will patch it back.
You kind of almost see yourself as an artist, right? Working on people's
So
faces. You have to be a good one.
Medicine with a bit of artistry.
Yeah. I mean, if you're looking at the client's best interest, you kind of have to look at it like you're going to craft it to...
Yeah, you sort of like know how to... You sort of... You need an eye for it. You need an eye for it.
Okay, then have you ever had a client come in and you can tell because you pretty much know what is society standards of beauty, right? And she looks, you can say just 99%. 99% looks already well, very well. And she's telling you all the things that she wants to be done that would make her not look, what you think is beautiful, or attractive. How would you advise against that?
So basically, I will... see, a lot of times people try to ask... You see, a lot of times female already know what they want. They already know what they want already. It's just whether the things that they want is correct or not. So most of the time they come, they say, okay, I want like that. Okay, I'm not happy then. So I have to go through a history, a very detailed history. I talk to them. I spend at least half an hour talking to them.
You mean first
consultation?
Yeah.
So iron out what are their concerns first. Because, if let's say, for example, they always ask me, okay, Doc, what do you think is beautiful? I say, what I think is beautiful may not be what you like. You get what I mean? And that is the worst thing, because if I want to start doing things that I think is beautiful on you and you don't like it...
But most of the time they wouldn't ask you, right? They already come in with what they want in mind.
Most of the time they will ask me.
Both they'll do both.
They'll do both. Because females, they already know what they want already. They already know what they want. They come and just basically reconfirm what they want is correct or not. Yeah. So they already know what they want already. So then after that, I have to come up with consultation, whereby what does she wants and what is important for her. Because frankly speaking, there's a lot of things that you can do. So, but the thing is most important, as dress was the most important. That is the primary concern, and then after that, from there you can work things out lah.
I still have me, for example, right? If my girlfriend were to say like they want to get this and that done, I don't think you need to get that done. You look fine, but of course I wouldn't stop them from doing it. Do you see clients coming in with their boyfriends and partners, and you hear how they discuss?
Yeah, of course.
It's common, right?
It's common. So this basically is just... Then that is between both of them, lah. I mean,
it's like what most of the time it's like what I say.
Yeah. So because the thing is, male perception, female is very different. Because the thing is, so our thinking is a little bit, we
are different creatures.
Different. Yeah. So but then again, I have to sort of like put myself in a woman's shoes.
Yes.
What she thinks and how she behaves and things like that. So most of the time, they do bring their couples, but I go through the consultation, same thing, manage the expectations, find out what exactly they want, and then after that, I come up with my own. So after talking to you, I already know what is your sequence of what you want to do, what are your beauty objectives. Then I can come up, then I see and assess myself, and I see whether our objectives matched or not. If our objectives match, then that is the correct procedure to do. So then after that, we go through the discussion. Then they go to discuss with their spouses or their boyfriends and see how they come.
I think most of the time it's gonna be like the husband will say, you do whatever lah. But
actually, some husbands say no, you don't do anything to yourself.
But they will say it in front of you.
No lah. I mean, some they do lah. Some they do lah. But then again, at the end of the day, they are here. I just give my best advice possible. Then you can go back and what do you call it? Discuss among themselves.
But you still charge them after this
consultation.
Well, the thing is, usually there is a charge for it. Usually there's a consultation charge, but most of the time I waive it off lah. If they do buy something lah, so.
Sure. What is the most? Because I know maybe 5-10 years ago it was different. Right now, what's the most common aesthetic treatment?
Well, the thing is,
I mean based on your client.
Oh, based on my client.
Not international, because it varies from country to country.
Oh, actually, Botox and fillers are still the top. You're not talking about machines, not energy-based devices and machines. Are you just talking purely on injectables?
I'm not sure about this. Do you do lip fillers as well?
Yeah, we do.
Yeah. So, is that very common in Malaysia?
Well, the thing is, not so.
Yeah.
Somehow or other, not so.
It's so huge in other
Yeah,
countries, right? Western
exactly.
countries. Huge.
Well, the thing is, we have to understand Asian beauty standards and Western beauty standards are entirely two different things.
I've had a friend, right? This friend that referred to this girl, another friend of mine that says, "Oh, she's chubby," and I'm thinking, if you said that to a white person, right, they will think you're crazy. Because even to me, my preference is maybe because I go to the gym, so I maybe like a girl with a bit more meat, Yeah, it's very different. Asians are in general maybe 10 kgs lighter, Just
You're not talking about body shape, you're talking about the face.
even facial
Even
features, they
facial
want
features.
smaller as well.
Yeah, of course.
Right.
Because in Asia, our face are broader. So that definitely we want it a little bit more slender, a bit more slim.
Oh, you mean Asians have broader?
Yeah, Chinese have very broad face.
Really?
Genet-
Compared to white people?
Yeah, I mean our skulls, different continents and
I didn't notice
the
that.
Caucasian skull and the Asian skull are two very different.
Broader but bigger?
Broad. Asian skulls are broader.
You mean like the cheeks?
The
that
cheeks,
side?
this side is broader, especially for Chinese. So it's broader and more flat. So the Caucasian is more slimmer and more protruded.
Okay, because I know that white people they've got bigger noses, much bigger. Asian noses are much smaller.
Yeah, we are genetically too different,
I mean, you ever been to Turkey?
Yeah, I mean,
They've got
big noses. Yeah,
big noses, like
Correct.
almost comic, like
Yeah, I mean, yeah. So Asian beauty standards and Western beauty standards are two different things. So sometimes when a Westerner comes and does a injection in Asia, so
You mean come to you lah?
no, I mean, the way they do it and how we do it is very different. So there are certain things where I can take and there are certain things I cannot take because some for example like fillers, right, the Western side to inject at this spot, which is actually the malar area. So this one, because in Caucasians they don't have this,
What is the malar area?
that it's part of the face. This is the widest part of the face.
The peak of the
Peak
tip of
of
the cheekbone.
peak of the cheekbone. So in Caucasians it's very flat. In Chinese very prominent. So you're going to inject here. Ooh, he's going to have a plate, face like a plate, very big. So there are certain things where we can do and there are certain things we cannot do.
This is a fun one. So let's say like I walk into your office and I'm telling you I feel ugly. What do you think I should get done?
Oh, then it's another consultation. No, I'm just kidding. So the first thing I would ask is, okay, why do you feel that you're not looking?
Okay. Yeah. So you have to go through the whole procedure and then ultimately...
because the thing is, you see, for example, like if let's say I do something and it's not something that you really want because your concern is maybe the eyes.
Yeah.
But I'm going to do something in the jaw. Then it will still not make you feel good.
I'm sure you've had clients that would tell you like they kind of insist like, you just do what you want with my face because I trust you. But you also cannot allow that to happen.
No, I will not allow it.
Because you know what is going to happen.
I
what
know,
could happen.
Yeah, I will not allow it. I will still so there are ways of asking, trying to get key points from them, try to dig further, try to make them, a lot of times I get this, like those really like they've done aesthetic procedures before.
Some experienced stuff.
So there's some experienced aunties and things like that. They just come, they just sit down and say, okay lah, tell me what I need to do lah.
What sorry?
Tell me what I need to do.
Oh my god.
So the thing is like, that one very dangerous.
They've been to many and their first time seeing you but they've been to many others.
So the thing is like, okay, that one very dangerous because you know why? If let's say for whatever you do also will not be happy because
not satisfy them.
You're trying to guess what she wants. You get what I mean? So I will say, okay, I can sit down here from now until tomorrow. If I don't understand what you want, nobody's going to be happy.
And perhaps for her, right, in her mind, it's like, I've been to this doctor, I've been to that doctor.
Yeah.
They've made me look like this and that. I'm not satisfied. Let me try something new. So it goes to you.
Yeah, because the thing is, I think it's because, again, you don't understand what she wants. So I would dig, lor. She always say, you tell me what I need, lah. I said, if I tell you what I need, but if you don't like it, also is no point. You know, there is so many things you can do. And if it's not something that you want, you'll be sitting here until tomorrow, nobody will be happy. So they say, like that, then you try to prompt her lor, say what makes you think that you feel that you're not looking your optimum and things like that.
Wow, it's really.
And then after that, the moment a key point comes in, then you know what already. Then you know what. Say for example, it's like okay, then you okay, when she walks in, you notice that her under eyes is a little bit sunken and things like that. And then after, but overall she looks perfect.
Yeah, looks a bit tired. Yeah,
a little bit tired. Then after that, but she's like, I don't know lah. You tell me what I want lah. Then I said that what do you think? You tell me lah. I said okay, look. When if you go through what you need to do from now to tomorrow, we will never come to a conclusion. So I tell you what when you see a mirror, what do you feel that makes you look tired? Makes you look ugly. I don't know. Then you prompt her lah. Said that in your back of your mind, her eye is a problem. I was like, okay, do you feel tired?
But you shouldn't directly suggest it lah, because you wouldn't know what.
So you try to prompt lah.
Yeah.
Are you usually? I mean, do you tired? Are you look tired? Yeah. You look tired. Okay, then you know already from there. Okay, then you once you get her to start talking, there are a lot of things will come out already.
Because you mentioned there are clients like this, right? They come in and then they just want to hand it over to you, right? It's easy to understand how, let's say if you're a less ethical aesthetic doctor, right? You just do whatever, and then that's how something a bad case can happen.
Yeah, exactly. So exactly.
There's actually clients that do that.
So they think I hand it to you, and then if let's say again, the receiver greedy, the giver also greedy, then bad things can happen.
It's kind of like you wouldn't expect someone. I don't know whether this is a correct comparison, but then let's say you go to a tattoo artist and you just say you do whatever. You would think that they would think twice, right?
Actually, frankly speaking, I think you can relate it to a tattoo artist because tattoo is a very personal thing to you.
Yeah, but people don't do that. They won't go there and say like you draw whatever you want on my skin.
Yeah, and then after that,
it's
if let's say you draw it and then you end up not liking it, then it's gonna be a complaint, forever.
But people don't do that as much as they would.
So if let's say the tattoo artist were to be a little bit more skillful handling it, you ask question, why do you want to have this tattoo? Is this tattoo significant for you? Why do you want to do it in this way? Why you don't want to do it in that way? And then make sure that it's substantial. Then it's like, okay, fine. That this is probably genuinely that's how she wants it.
But I think in general it doesn't happen commonly.
Well, the thing is, it doesn't happen. I don't know because
not your industry.
Yeah, I think you can sort of relate it in similar way.
What is trendy, very trendy now, or you feel like it's upcoming?
Well, I mean,
do people come in all the time and then they'll show you some of their favorite Korean stars?
Not really lah. They usually have done their homework on what they want to do already.
Okay, let's say, for example, I don't know whether you can say this, like for Malay, do they come in saying they want to look like a specific Malaysian person, influencer, or? No, I have not. Because I think the crowd that comes into my clinic is a bit older, is it?
Are a bit older one. So, my probably like 35 to 60.
That's why they're trying to they would hope that you can recommend what to do.
So most of the time my procedures would involve around restoration work, like I mentioned, it's sunken cheek, I plump it up. Sometimes the older men, they have got all this sunspot because they never put sunscreen, got sunspot, they have to do some laser to remove it. So it's all a lot of mopping up dirt, fixing the cracks, smoothing out the bumps and things like that. So that's the core of my clinic.
Are you married or are you single?
I'm not married lah.
Not married. So something you see, right, as a single person, right? What happens when it might be a bit confusing when you meet a client that you know what you think is pretty, right? And then she's telling you that she's not happy with this and that, and then how do you go about that? Like, do you ever give your opinion? Or like, say, I think you look fine.
Yes, I do.
Yeah,
I do. I do.
It does help them. Does it help them?
Of course.
Help them change their.
Yes, of course, definitely. Because the thing is, sometimes you see a lot of them, they go they talk to your friends.
Yeah.
They see social media and
Maybe
things
they
like
talk
that.
to girls, not guys.
Guys and girls, whatever lah. So the thing is, like, okay, this particular person has done this, and the result is fantastic, and I get this. So I also want to be like that. But the thing is, the treatment may not be suitable for you.
Like you mentioned before, the shape of your
Yeah,
face,
not only
your-
fillers lah, for anything, for any procedure may not work for you. So a lot of them I want to follow also, but it doesn't work for you. You know, because you can already anticipate the outcome. Oh, this will not work for you lah. So you try to tell them, I don't think so. It's the right thing for you to do. The reason why is because, actually, most of the time, if you tell them, you spend more time with them, you tell them why it doesn't work, they will understand. It's when you tell them why you don't work and then you don't explain yourself, you say, no lah, it doesn't work lah. Then they won't accept it. So it's usually you have to just sort of like tell why. If let's say, for example, why does this thing will work, then you explain why this will work and the outcome. These are the outcomes that you can get.
You know, like just in general, beauty standards, beauty trends, it changes all the time. 5-10 years.
Yeah, of course.
For example, I was watching, Silence of the Lambs, right? So you've got Jodie Foster, and it's looking at her eyebrows, right? I'm looking at her eyebrows then, which is really thin, barely any shadows. You compare to eyebrows today,
It's thick
thick
and flat.
Kind of like squarish also, strong shade.
So yeah, beauty standards of course change over time. For example, not only eyebrows, like I think probably you've heard before this apple cheeks.
Apple cheeks is?
Apple cheek. Yeah, she's nodding away. She know apple cheek.
What is apple cheek?
So basically, okay. So in Korea, they like this huge apple cheek, like pillow cheeks like that. So that was, I think this trend was like maybe in 2013, 2014 when I just joined. So apple cheeks was a trend because it's like it denotes youth. They like to pump up the cheek big like that. But over time, the trend lost its popularity, and now it's considered overdone. So
And then when everyone has the same thing, then you kind of don't want to be just like everyone else, maybe.
a lot the time I still remember everybody, I want pillow cheek, I want like this cheek, 苹果肌, and in Mandarin like this big huge cheeks, But now actually just recently I've got a patient or client of mine came in who had that done before, and then after that regretting it, then asked me to
Go back, right?
remove it. I mean, so another good thing about hyaluronic acid fillers is there is an antidote for it. So a lot of fillers, they don't have a reversal. So this has a reversal.
Okay. What is the reversal?
It's a medication where I injected the area of the previously filled with hyaluronic acid, and it will just melt away. So that is a good thing about hyaluronic acid. So there is a safety net for you.
Okay. For example, something that I don't know whether there's a safety net or turning back, right? This is not facial aesthetics, or let's say butt lifts or butt implants. Those are no.
Butt implants are surgical.
Yeah, there is a turning back, but
Yeah, you can remove the implant.
but it's also, what happens to your skin?
Be probably lax lor. But usually, if let's say there is an excess skin, they will cut it away lah.
Yeah, so much
But
work,
buttock implant is a very rare thing in Malaysia. I don't know. I mean, I'm not a plastic surgeon.
Yeah, definitely. Even boob implant, which should be much more common than butt implant, right? In Malaysia, even boob implant is not so common. Of course, getting more and more.
It's actually getting more and more.
It's getting more and more.
It's getting more and more. Really. It's actually not as uncommon as the last time. It's actually quite a number of people.
So reason why people might think is very uncommon is because they assume, right, that if it's a breast implant, you can tell one. But if the doctor is good, then you're not supposed to tell.
Yeah, of course. I mean, the thing is, breast implants, depending on how many cc's that you want to put in your breast. So if let's say, for example, you want to, you're a small size girl and you put in some watermelon size breast, of course, it's very unnatural. It's probably very in your face kind of thing.
It's damn obvious.
But if let's say if it's done tastefully, according to the proportions of your body, then yeah, it's actually very beautiful.
For example, I've had I've asked a couple of people about whether they think Miss Puyi has done her boobs or is it natural, and most of the answers will be natural. They always say natural. I like to think that I wouldn't know, because how can you tell? Of course it looks natural, but how can you tell when, if this doctor is very good? You're not supposed to tell.
I don't know. I don't know because I've not examined Miss Puyi before.
But most people will say it's will say like, oh, natural.
Well, the thing
you
is,
don't know.
well, the thing is, why don't we just say looks good on her?
It does look good.
Looks good on her, okay lah. You get what I mean? Not.
Yeah.
You know, I mean, so it doesn't look unnatural. It looks good on her, so I think that they're good for her.
What looks natural looks good.
Huh?
What looks natural?
Whatever is pleasing to your eye.
Yes, exactly.
Yeah. So I mean, if you look into the definition of beauty, it's basically, in a nutshell, what is pleasing to your eye. So that's why they say that beauty is in the eye of the beholder. That means whatever you see that evokes a positive emotional response in you, that is beautiful, lor.
Yep.
You get what I mean, not? So if you look at something and it makes you feel good, it makes you feel happy, it makes you feel positive, then it's something beautiful, lah.
Yep.
That's to you. So yeah, I think that's the general definition of beauty anyway.
Can I asked you this question just now, but I want to ask again, and I want to get an answer just for fun. Okay. So yeah, I walk into your clinic and I tell you I'm not happy with my face. I want you to make it look better, but we have to skip the consultation and you have to give me some suggestions just for fun.
Okay.
So what would you say?
I think I have to do something in your eyes.
Why are you so direct?
Huh?
Do what to my eyes?
Well, I think you've got a ptosis of your eyes. That means your eyelids are droopy.
Okay.
Your eyelids are actually droopy, and it's covering the black of your eye, the pupil.
Maybe that's the reason why I've had a lot of people always tell me, you look like you're stoned. You look like you're high. Always tell me that.
Yeah.
Actually, I'm not.
You have what you have got ptosis. That means basically your eyelid muscles are weak, and it's now coming down and covering part of the black of your eye, the pupil. So you make you look like sleepy. If you look at him, you see his eyes is, it's
Doesn't he
way
have
up.
sleepy eyes as well? No,
I mean,
not really.
yours is worse.
Okay.
So basically you eventually, if you age, the ptosis will become worse.
Naturally lah.
So you actually have to get surgery.
Surgery ah.
Yeah, you have to correct that.
So aesthetic cannot.
Aesthetic cannot.
No. Yours is a surgical case. So basically here,
Not what you can help with.
yeah.
lah.
So here, as an aesthetic doctor, also you also must know your
field.
your capabilities. So there are certain instances whereby you have to draw the line and say, you know what, this is the thing that I cannot do. So like for example, like your case is like,
What do you call it?
eyes,
Sorry.
ptosis.
Ptosis
Ptosis.
This is the name of.
The condition of your eye.
It's a condition.
Yeah. The
I thought I'm
eyelid
healthy. I'm normal.
yeah, it's a condition whereby your eyelid muscles are weak.
Okay. It's a condition. It makes it sound very bad.
No, it's your eyelid muscles that's a bit lazy. So for him, it would be functional. It will be functional because eventually, in another 20 years, the eyelid muscles will further weaken, and you will cover almost your pupil, and then you won't be able to see properly.
Oh, okay.
Because it will start to cover your pupil already, right? So
okay.
you will start looking like that.
Damn, okay.
So yours will be a functional correction. That means you have to correct it properly.
But based on your knowledge, is this something complicated?
No. Plastic surgeons and oculoplastic surgeons, these are their bread and butter.
But what are the things that causes this?
Probably so young, probably genetics. I don't know.
Genetics is mostly majority of it.
Yeah, so you look into your family, someone will have the same problem as you.
Okay.
Yeah.
Small eyes.
I mean ptosis, that the weak muscles.
Yeah.
So
how do you tell again? How I don't understand.
actually I have to draw it out for you.
Basically, you look one time, you can tell.
Yeah, it's covering up, because the thing is your eye, your iris is like that. The brown part of your eye is supposed to cover only 1/5 of the eye, but yours is almost covering like almost half already.
But I think looking at his younger pictures, also like that already.
Yeah, probably it's.
That's why he knows me.
Probably then this is genetics, so
Yeah.
it's genetics, so you're just born with it, so you probably have to look for a plastic surgeon or an oculoplastic doctor to get it surgically corrected.
Okay, so that's number one lah. Number two, is there what else comes to your mind?
I think probably your under eye area here lah.
Eye bags
Yeah, it's not eye bags. It's just flat here.
Flat.
Yeah, here.
What do you eye bags is actually about the wrinkles down here?
No, the eye bags is basically
The black colour shade,
No, you notice there's a black color shade and there's a little puffiness there.
Mm-mm.
So there's eye bags.
Ah.
So but underneath the eye bags there's an emptiness there.
Here is it?
Yeah, there's an emptiness there.
So what can be done?
Fillers, oh.
Just that's very common, no? Just fillers. Anything else?
You can do a couple of Botox. You got some lines on
I've had that since I was a baby though.
yeah, because you know why? Because you see, you have the line here is because you are using your forehead muscles to try to lift your eyebrow up to compensate that weakened your weakened eyelid. So you're using your forehead muscles to try to pull your eyelid up. That's why you have the wrinkle there.
Because I think Brian didn't share your eyesight power since how old?
What do you mean? Didn't share?
Since you were young.
Since I was young, I had my power was about 700. Since
So
I was
you're
young.
always because because it's the weakened eyelid. You're always trying to open your eye.
Yeah. Oh.
You're
okay.
always trying to open your eye using your forehead muscles to pull up the eyelid.
Okay. So it could also not be only genetics. It could be that something like I'm always doing this.
Because the thing is, it's because of
Because genetics, your
eyelids are weak. So you're using forehead muscles to compensate that.
Okay.
So you're actually not a very good candidate for Botox.
Why?
Because if you're going to weaken or put these forehead muscles to sleep,
Yeah.
then your whole eyelid will drop.
Okay. Then also I would have to do something there, and then.
So
it's
you
just
have
not-
to do, if you want to remove the lines here, you have to first correct your eyelid
Then
first.
only you
Then
can do
only
the-
you can do your Botox.
Okay.
So yeah.
But I know since I was young, I always had the lines
Yeah, because
already.
your forehead muscle is always trying to compensate your eye. You're trying to open your eye.
Okay. What is the most like? Is there do you have any cases where clients have a very ridiculous requests for you to do?
Wow.
You don't have to say names, of course.
I mean, yeah, of course. Ridiculous.
Yeah. Where you're just like, no, it's not going to happen. Like, I can't.
I mean, I do remember.
Cosmetic doctor, I'm sure they faced a lot of that.
Yeah, the plastic surgeons. Yeah, I'm
Yeah,
sure.
a lot. For you?
Yeah, I mean, basically, I wouldn't say ridiculous lah, but I put it like unrealistic expectation. Yeah, I mean, you know, for example, like there's a skin condition called melasma, the pigmentation.
What is that like?
It's basically pigmentation in middle-aged women. It's like big huge patches,
Spots or
big huge
spots
patches,
okay.
big huge patches on the face and things like that. So there are certain
They had to go to a plastic surgeon.
no
for that,
lah. I mean,
right?
this one's dermatologists and
Yeah,
dermatologists lah, or aesthetic doctors lah. You know.
You can handle it, lah.
Yeah, but then again, the so-called
You're considered dermatologist and
no, I'm not a
aesthetic doctor.
dermatologist. I'm actually a aesthetic doctor.
What is the main difference is you don't handle stuff
I don't
like what?
I'm the dermatologist is registered under the National Specialist Registry. So they have got your doctor's degree, and then they go through masters of dermatology, masters in dermatology and things like that, and then they will convert a specialty.
It's just the qualifications
so
that's
they
different.
undergo stringent long training. I mean, you want to be a dermatologist, I think you need at least 13 years.
And most of the time, dermatologist is not just the face.
They handle a lot of other skin pathologies lah, you know, like cancers, sexual transmitted disease, skin issues, and then also you know, all this chronic.
Sorry, if I'm not mistaken, you only, when you say aesthetic treatment, it's mostly just the face. Is it the neck maybe?
Yeah, neck
but not
and above.
nothing on the do
Neck,
you ever
neck and above lah.
do you ever do below the neck stuff?
Below the neck stuff, basically, like, say for example, like stretch marks on the tummy.
What can you do to stretch marks?
You can do some lasers.
You
can do some resurfacing lasers.
Is it that simple nowadays? I mean, I've always assumed that stretch marks, you would have to have some sort of surgery.
Not really. That is excessive skin. Then you can do excessive
okay.
skin, like, you know, too much of skin. Then
Stretch marks will not go away if you don't do something about it.
stretch marks, yeah, you will not. It will be there, you know,
Okay.
because technically stretch marks are considered like scars like that.
Okay. I remember I did have some stretch marks before. So it's just a simple
So you can
laser.
do some lasers. You can do some resurfacing lasers, and
Does it come out very clean?
the recovery about 30-40% after a couple of sessions.
What do you mean by 30? Oh, you mean
That means the outcome 30-40% improvement.
much better?
Yeah, much
It
better.
doesn't come back, does it?
You have to understand that stretch marks, right? Once the skin is damaged, it's considered a scar already. So stretch marks are considered a scar.
Yeah.
Because it's damaged tissue. So when they heal, it heals with scar tissue. So you just want to tighten it and then also make it less obvious. So that's the idea of all these treatments.
Okay.
So yeah, back to the story, like unrealistic expectations,
yeah.
like that, like some ladies with bad melasma and things like that.
What
I
is
want
the-
this.
Melasma is the pigmentation.
Yeah,
right?
a very chronic pigmentation. So that kind of pigmentation, your improvement rate is very little, and then also the recovery rate is also very high.
What could you do?
So basically, you have to give some creams and things like that. So some ladies like, I want totally white,
Yeah.
So I will totally nothing there. So and you know that this condition will never become totally 100%.
It will come back, is it?
It will come back. It will come back, or it will improve. Then after that, it will bounce back again.
I mean, if you go to a plastic surgeon, they can make it look good for a
No.
while.
No, not even
no.
not even that. So it's a very tricky situation. So that is one level of unrealistic
You can't
expectation.
fix everything.
Yeah, I can't fix, because you have to understand. I mean, it's still medicine. Medicine still there is a limitation to
yeah.
everything.
But it's very interesting to see what happens in 10 years, right? 10 years, 20 years.
Yeah. I mean, the thing is, from 10 years ago when I started aesthetics till now, I mean,
Yeah, what did they not have then that is quite prominent right now?
I think improvement in hyaluronic acid,
Yeah,
fillers,
yeah.
certain fillers, machines.
Improvement as in failure rate has reduced significantly, is it? Or?
Techniques are much better now.
Mm.
The techniques are more refined, products are more refined, machines are more accurate. For example, like the biggest hype is pico lasers, and
Which is lasering.
which is a pigment laser, that is like the biggest what do you call it, the change in the aesthetic industry.
So people do lasering to make their skin smoother, is it?
Well, there are many different kinds of lasers for different skin conditions. So it's not one size. It's not one laser that does everything.
Yeah.
So laser have got certain lasers for, for pigments.
Yeah.
There are certain lasers for scars. There are certain lasers for what do you call it? For rejuvenation. So there are different lasers, or some lasers for blood vessels. You want to remove some blood vessels on the face, the small tiny ones. So there are different lasers for different skin condition.
Okay.
So depending on how much investors you have for your clinic, or how much money you have, you
Yeah.
can buy how many, because one laser machine is not cheap.
Yeah. Okay.
Yeah, so
You've got that in your clinic?
I only got 2.
Okay.
Yeah, 2 so far. But there are
Limited.
centers which they have 10 to 15 different lasers. They are more established clinics.
If you have to take a wild guess in KL, how many aesthetic clinics are there?
Oh, there's a lot. That's a lot. I mean,
And you would say that maybe most of them has came up in the last 5 years.
oh yeah, definitely.
A lot, right?
A lot. I mean, easily there's about 300-400 at least.
What
in
about
Klang
10 years?
Valley.
What about 10 years ago?
10 years ago,
Which is when you first
when I first joined.
what clinic was that you mentioned just now? Is in KL also,
Yeah,
right?
it's in
Okay.
KL, it's in Puchong actually. It's just my first clinic where I did. There were a lot as well, but and when it started to pick up, so more businessmen want to invest in aesthetic clinics, so
Yeah,
they
yeah.
open up branches, and the last 5 years they just exploded. One brand of aesthetic clinic, and open chains of it, like 15 branches.
But as the amount of businesses has increased, right? Also, the demand also is going up, which is
Well, of course,
proportionally.
the demand is definitely there. I mean, frankly speaking, even though how competitive it is, no one can take the pie themselves.
Yeah,
you know.
like basically there's enough for everyone.
Definitely the size of pie is smaller lah. If you started off 15 years ago, definitely
Oh, okay.
you be a little bit more in a better position. But if you start like like last year, like for me, it's like your slice of pie is smaller.
People have this just a perspective lah of, let's say, aesthetic doctors or cosmetic doctors, right? They kind of like rock stars because they're always associated with high value, high network clients all the time. Is that the case?
Well, the thing is, if your clients is a celebrity, then
Yeah,
probably lah, then you'll be associated with it. I mean, it depends on how you want to. It depends on how you want to be and what you want to
market
be.
also.
How you want to market yourself.
Yeah.
So if let's say for example, I mean, I know of some of my friends. So he wants to open and he wants to be the spokesperson for aesthetics, and
Okay.
and he market himself.
He's
that way,
playing the
and-
influencing
and,
game.
and yeah, and he's very successful, and he's very successful. I mean, so he's like the rock star. I mean, he hangs out with rock stars as well.
But I'm not sure, maybe until I meet him, but I feel like, no matter how popular you are, and I talk to a doctor like you as well, who's maybe not so big in Instagram or what, I feel like they're pretty much gonna say the same things. So it's just that they don't know certain people, they don't hang out around.
I mean, it's how you market yourself.
Yeah.
It's really how you want to market yourself. So, I mean, for me, I'm quite like low key person. I mean, I enjoy my job. I love my
Sure.
job. I mean, of course, if you see, I'm quite a camera shy person, so
Are you? I think you did fine, man.
okay
Yeah,
lah.
you're talking fine.
Okay, now I'm a bit more comfortable.
We didn't even
but-
have to drink anything.
a bit more comfortable because the thing is, before this I was really really camera shy. So because I'm doing my own business now, I'm forced to do things. I had sort of like my marketing person told me, it's like, Doc, you
Very-
sort of have to do something
Very
about.
hard to survive.
It's like you have to dance a little, say a little something.
You're talking about those things.
Yes, I was like, oh, okay. You have to like do funny things on social media. It's like, okay.
Unfortunately, what that guy is telling you is true, lah.
Yeah.
You have.
So okay, I mean, I accept it, and then just go with it, lah.
Also, by the way, if you do know cosmetic doctors, it'll be great if you can refer to me.
Can,
the
no
next time I
problem.
can talk to them. Yeah. It's okay, don't you say now.
Okay, yeah.
Yeah, I think we're gonna wrap already.
Cool.
Yeah, I guess how long we've been doing it?
I don't know.
10 minutes under 2 hours. Yeah. So do you feel fast?
Actually, we had a good conversation, though.
It's a good conversation. This, I do a lot of podcasts with, a lot of times it's also with influencers and like comedians, right? Which is very fun, but this is what I really like, man. I love speaking to Dr. Lenny, the child psychologist.
Yeah.
I think it's because it's very refreshing.
I think because it's like you've not heard the perspective from another group,
Let's put it this way, lah. Those people that had all those bad perceptions of aesthetic treatment, right, or aesthetic doctors, they sat down with you for 2 hours, their perspective will change.
Yeah.
Yeah.
So I mean, it's all about sharing and re-educating.
Yeah.
So I mean, like earlier we mentioned that that those beauticians out there doing all these things. I mean, you can't fight them because the thing is that
They're still
there
gonna
are a
be there.
lot more. I mean, if let's say for example you clamp one, there's 10 who's going to do it.
Do they get fined?
Huh?
Have you heard cases of them getting shut down?
I mean, of course they do, but the thing is the enforcement processes actually takes a long time. It's not that the government is not doing anything, but the thing is the processes that's involved.
Yeah.
It's very long-winded.
Yeah.
So and the rate of them coming up is tremendously a lot. Today you close down one, 10 will open tomorrow.
Yeah.
So it's very difficult to fight them. I mean, there are over 15 to 20,000 beauticians
Wait.
in Malaysia.
Oh,
It's a
dear.
lot.
Yeah.
And that is just registered.
Yeah, that's very. Oh, it's actually very bad news for you guys, man.
It's not really bad news. For me,
don't think so?
I don't think so, because the thing is, in Chinese,
They're taking a big chunk of the pie, though.
you got your bowl of rice, I got my bowl of rice lah. You get what I mean or not?
You're being nice about this now.
So,
but the truth is,
the truth is,
you
not
could be a rock star without all of them.
well. The thing is, I put this way, I can't survive without them. Also, I mean, their network is just tremendous.
Yeah.
Their network is just tremendous. So, what I think is important is to educate the public slowly. I mean, the thing is, it's a long process. You can't fight them. Because the thing is there are just too many. You just can't fight them. So what we can do is slowly, day by day, educate those people. They need to be educated.
And perhaps they also have to work on getting their qualifications.
Yeah, and then if let's say anything were to do with needles and poking your skin and injecting things, probably it's wise that you want to seek a doctor and things like that. I mean,
Yeah.
I mean, no worries. I mean, you can go and do your face. They have got beautiful, nice facial machines, and then their massages are best in the world. The environment is very cozy and is very nice. Of course, no problems. I mean, but then again, when they start doing things like that, and it's actually a very bad thing, because if let's say the blotch job happens by a beautician, then they go and get reported in the media, the whole industry we will be dragged into it.
Yeah.
Aesthetic, tajam,
No, really,
injection.
really.
And then after it was like, we will be at the side there watching, and then we will get fired as well, because the thing is, you see that particular person is getting injected and then it's hurt and things like that, but it's got nothing to do with us, what?
Yeah. So you say 20,000 beauticians, maybe that is an estimate. What do you think aesthetic doctors there are? Like the amount in Malaysia?
Well, there is a website for you to check whether it's actually in the Malaysian Medical Council website, where you had
Hundreds, is it?
where they list down the registered aesthetic doctors.
Okay.
So usually when you want to do aesthetics, right, you're supposed to sit for an exam where the government will then give you a letter of credential and privileging to practice aesthetic medicine.
So anyone, let's say a regular person like me, if I'm going to this this person who is probably a beautician, I did not know, all I have to do is search it up and I'll be able to find whether they are registered, licensed.
You can search the doctor, whether the doctor is a registered medical practitioner, and also you can see whether that particular person has got a LCP, or a letter of credentialing privileging for aesthetic medicine. You can check these things, and then the premise, you actually can check whether this particular premise is a registered medical, what do you call it, facility.
So LCP is the license, right?
LCP is the license for aesthetics. APC is the license for being a doctor. Borang B is the license for the clinic.
When you transitioned from the hospital to working in the aesthetic clinic,
I have to be trained.
the LCP.
Yeah, you
course,
have to be trained. So it's actually you're supposed to follow some certain guidelines, some certain recommendations, things that you need to do. You have to be a fully resident medical doctor, and you have to serve in the government for your compulsory service. Then you have to take up a course in aesthetic medicine. I mean, there is a couple of courses. One of it is a Malaysian aesthetic certification. So in Malaysia, then you have to take that, and then after that, then you have to be in a aesthetic clinic, hired for 2 years, so things that are done under supervision, and then you have to fill up your logbooks.
It's a very detailed, thorough process.
You after that, you have to then apply to the Kementerian Kesihatan to sit for an exam. So the exam is 2 parts. One is the written exam, MCQ, and then after that, you pass that, then you undergo a viva, basically like an interview whereby 4 doctors will sit in front of you, the dermatologist, plastic surgeon, 1 senior aesthetic doctor, and 1 representative from the Kementerian Kesihatan to assess you whether you're a safe aesthetic doctor or not. And then after that, you pass, then you can practice.
This is a very well developed system, right? Actually,
it's the only system that is in Southeast Asia.
Sorry?
Even Singapore doesn't. Singapore have something
very
similar to it, but
structured.
it's the only country in Asia where we have this. In Malaysia, where they have this certification.
Wow.
Thailand, Taiwan, don't have.
Okay. Yeah, and then those beauticians just want to skip the process.
So they're not eligible to sit for the exam. Lor?
Yeah, of course, they didn't go through.
So again, we have to educate people. Or you want to do aesthetic procedures, go to a doctor, which is a registered medical practitioner with a valid LCP and also practicing in a a registered medical facility
for a certain amount of time
in a clinic.
Yeah. Okay. Any last takeaways?
If you don't understand, you just go to the nearest aesthetic doctors. They are willing to share information. Don't listen to misinformation. Hearsay. Don't be so like
Close-minded
or trapped into cheap stuff, because cheap stuff doesn't really do you good.
True. It's true. You cannot be cheap when you're looking into aesthetic treatment.
Well, the thing is, aesthetic treatments per se is not cheap, to be frank.
Of course, but you also cannot be on the lookout for a bargain.
Yeah, the thing is, if let's say the price is way, way too low than the market rate, then something is not right. Yeah. So and look for the right doctor with right.
Look for Dr. Park. Why not?
Look for your nearest and the most trusted medical doctor available at your area.
So guys, Dr. Park located in OUG, right?
Happy Garden.
Sorry?
Happy Garden.
That's nearby OUG.
It's pretty much nearby.
Okay. What's the name of your clinic?
Dr. Park Clinic.
Dr. Park Aesthetic Clinic.
No, it's Dr. Park Clinic only.
Okay, Dr. Park Clinic. Yeah. Okay, Dr. Park is great to have you on. Perhaps maybe in future you can chat again.
Yeah, sure. It's a pleasure coming to talk to you.
It's a pleasure also. I've learned a lot. Alright guys, if you listen up till this point and you've enjoyed this episode, put in the comments, let's get it, with a splash sign, okay, to symbolize you're excited, alright? And share your thoughts, share this video with your friends. Most importantly, hit the subscribe button.
Hit the subscribe button, yeah.
Yes, hit the subscribe button, okay? This guy has been doing a lot of TikTok dances. So you can... No,
me too.
Yeah, only two. Okay, but guys, yes, appreciate your support so far all the way. And I'll see you guys in the next episode. Give it up for Dr. Park.
Thank you so much, Ali.
All good. Oh.
Missing my homies, I'm missing my oldies, my brothers, my cronies. We all went to court, but before only courts that we knew were the ones where we were shooting three, selling Kobe. To a legend, rest in peace to the old me, rest in peace to my brothers, rest in peace to my whole team. The oldest, I'm missing my shawty.